The harsh fluorescent lights of Metropolitan General's conference room cast unflattering shadows across my parents' faces as they reviewed my proposal. My father's reading glasses perched low on his nose as he flipped through the meticulously prepared documents, while my mother's perfectly manicured nails drummed impatiently on the mahogany table. Dr. Elizabeth Carter, my father read aloud, his tone dripping with disapproval. Requesting to buy into the Carter family practice. He looked up, sharing a knowing glance with my mother. Your timing is interesting considering your current position. I remained silent, watching them dismiss 3 years of careful planning with each condescending page turn. To them, I was still the disappointment, the daughter who chose emergency medicine over their prestigious private practice, who worked nights in a crowded hospital while they treated Manhattan's elite. Really, Elizabeth? My mother sighed, pushing the proposal away. A resident's salary? You can't possibly think you can afford this. I've saved carefully, I replied, keeping my voice even. And my work in emergency medicine has given me valuable experience. Experience? My father scoffed. Racing around the ER like a common medical worker? Our clients expect sophistication. They want the Carter name to mean something. Little did they know how much the Carter name would mean after tomorrow's board meeting. I've built a solid patient base, I continued. Your emergency department satisfaction rates are the highest in the emergency department, my mother interrupted, adjusting her Hermes scarf, where you treat anyone who walks in. She said it like it was an insult to our family's medical legacy. My phone buzzed quietly. Likely another update from my lawyers about tomorrow's announcement. I ignored it, focusing on the meeting I knew would end exactly as I'd planned. You can't afford to buy into our practice, Dad declared finally, snapping the folder shut. Not now. Perhaps in a few years if you reconsider your career choices. You mean if I abandon emergency medicine? I asked quietly. If you start practicing real medicine, he corrected. Private practice. Selective clientele. Building relationships with people who matter. I thought of the contract waiting in my office upstairs, the one they didn't know existed. Tomorrow's board meeting would indeed be about relationships with people who mattered, just not the way they imagined. We're doing you a favor, Mom added, her voice softening with false concern. The buy-in alone would bankrupt you. And our patients, well, they expect a certain standard. Your emergency room stories about gunshot wounds and overdoses would hardly impress Mrs. Astor during her Botox consultation. My phone buzzed again. This time I glanced at it. A message from the hospital board secretary confirming tomorrow's 9 a.m. meeting. I understand, I said, gathering my proposal. Thank you for your time. That's it. Dad looked surprised at my lack of argument. No debate? No pleading? No, I smiled slightly. I think tomorrow will bring enough changes without any debate today. Finally learning your place? Mom asked, pleased at what she mistook for resignation. Something like that, I said, straightening my white coat. I should get back to my shift. Those common emergency patients won't treat themselves. As I walked to the door, Dad called after me. Elizabeth, we expect you at the hospital board meeting tomorrow. As part of the Carter family, you should at least show face when they renew our privileges. Oh, I'll be there, I assured him, thinking of the sealed envelope upstairs. I wouldn't miss it for the world. The next morning, Metropolitan General's boardroom buzzed with quiet conversation as members and department heads filed in. My parents sat near the front as they had for 20 years, their pristine white coats gleaming. I chose a seat at the back, watching them network with their usual crowd. Plastic surgeons, private practice owners, the kind of doctors who saw medicine as business first and calling second. This meeting of the Metropolitan General Hospital Board will now come to order, Dr. Williams, the aging chairman, announced. Before we begin our regular agenda, we have an important announcement. My parents straightened, likely expecting their annual privileges renewal to be fast-tracked as usual. As you know, Metropolitan General was recently acquired by Summit Healthcare Group, Dr. Williams continued. Today we're honored to introduce our new Chief of Medicine, who will also serve as CEO of Summit's entire East Coast division. Dr. Elizabeth Carter, would you please step forward? The silence was deafening. My heels clicked against the hardwood as I walked to the podium, savoring the sight of my parents' faces draining of color. Elizabeth, my father's voice cracked. There must be some mistake. No mistake, Dr. Carter, I replied formally. Summit Healthcare Group acquired Metropolitan General 3 months ago through a series of private equity deals. Deals that I orchestrated. Impossible, my mother whispered. You're just a resident. A resident who spent 3 years building a healthcare investment firm while working emergency medicine, I corrected, opening my laptop. Summit Healthcare is my company. I own 67% of Metropolitan General and 5 other hospitals across the East Coast. The screen behind me lit up with financial records, acquisition details, and my official appointment as chief of medicine. My parents stared at the numbers. Billions in assets, thousands of employees, and their daughter's name at the top of every document. Now, I continued, let's discuss some changes. First, the hospital's mission statement. We're expanding emergency services, doubling trauma capacity, and launching a new community health initiative. But our practice, my father stammered. Our privileges. I simply smiled. Tomorrow had arrived. I pulled up another document. As chief of medicine, I'm reviewing all private practice privileges, I announced. Those who don't meet our new standards, including minimum hours of emergency room coverage and community clinic service, will have their privileges revoked. You can't do this, my mother shouted, standing, her voice trembling. We built our reputation here. A reputation for choosing wealthy patients over critical care, I replied calmly. That ends today. Metropolitan General will serve everyone, not just those who can afford boutique medical services. The board won't stand for this, my father declared, scanning the room for support. But the other board members remained silent, many nodding in agreement. The board already voted, I informed them, displaying the results on the screen. Unanimous. Your privileges are suspended pending review. You have until the end of the month to either meet the new requirements or find another hospital. Were your parents? My mother hissed. Yes, I said, smiling faintly. And you taught me well, about business, medicine, and power. I just chose to use those lessons differently than you expected. 1 month later, I stood in Metropolitan General's newly renovated emergency department, watching the controlled chaos of a level 1 trauma center. The expansion was nearly complete. Double the beds, state-of-the-art equipment, and a staff finally equipped with the resources they deserved. Dr. Carter, my assistant, appeared at my side. Your parents are here for their meeting. I nodded. Send them to my office in 5 minutes. I need to finish something first. I walked to Trauma Bay 1, where a young resident treated a homeless man with infected wounds, the kind of patient my parents would have turned away a month ago. Good work, Dr. Chin, I said, reviewing her plan. Make sure he's connected with our new outreach program before discharge. Yes, Chief, she smiled, still amazed that the chief of medicine regularly worked shifts. In my office, formerly my father's, I waited as my parents were shown in. They looked different now. Humbled. Tired. Maybe even a little scared. Elizabeth, my father began. We've reviewed your requirements. I gestured for them to sit. The ER shifts, my mother said softly. We've started them. And the community clinic hours. I pulled up their files. 3 nights in the ER. 2 afternoons at the clinic. That's a start. It's enlightening, my father admitted. Last night we had a multiple trauma case. A gang shooting. I haven't handled anything like that in years. Welcome to real medicine, I said, recalling the times they mocked my ER stories. Where you don't choose patients based on their bank accounts. My mother leaned forward. We've been thinking about your original proposal to join the family practice. I raised an eyebrow. We were wrong, my father said simply. About you. About emergency medicine. About everything. The work you're doing here, it matters. All medical work matters, Dad. I tried to tell you that for years. I stood, moving to the window overlooking the ER entrance. But this isn't about me joining your practice anymore. They exchanged a glance. What do you mean? Carter Family Practice will be absorbed into Metropolitan General's new community health initiative, I said firmly. You can stay on as attending physicians working alongside the colleagues you once looked down on. Same salary as everyone else. Same rules. Same commitment to every patient who needs help. And if we refuse, my mother asked quietly, then you'll need to find another hospital. Good luck with that, Summit Healthcare owns most private facilities in the region now. My father nodded slowly. You planned this. All of it. The resident work. The investment firm. The acquisition. I smiled slightly. I learned from the best. You taught me about power and prestige. I just chose to use them to change the system instead of exploiting it. My phone buzzed, a trauma alert. Multiple casualties incoming. I need to get to the ER, I said, grabbing my white coat. The paperwork's on my desk if you want to stay on. Either way, Metropolitan General will keep serving everyone. That's non-negotiable. At the door I paused. Oh, and if you do stay, those ER shifts aren't temporary. Every doctor works them. Including the chief of medicine. Especially the chief of medicine. As I headed to the trauma bay, I heard my father's voice behind me. We'll sign. I smiled, the wail of approaching sirens filling the air. They'd finally learned what I had always known. True medical excellence isn't measured by the wealth of your patients, but by the lives you save no matter who they are.